Now coming to exercise physiology. Exercise, there will be respiratory changes as well as the cardiovascular changes. But predominantly, most of the changes are happening in the cardiovascular system. So that's why we are discussing exercise physiology along with the CVS. So whenever a person is exercising, we can do two types of exercising. Exercise is basically divided into two types. One is the isotonic kind of exercise. Another one is isometric kind of exercise. So what is isotonic? As the term indicates, here the tone is constant. Here the muscle tone is almost constant. Muscle tone constant. But what changes? Here the muscle fiber length changes. Muscle fibers length changes. Length change can be there. And what is the example? Most of our activities where there is a contraction and relaxation is happening, those are a kind of isotonic exercise. So running, jogging, everything is a isotonic exercise. Running, jogging, all are isotonic exercise. So isometric, here as the term indicates, isometric. Here the length is constant. Here the length is constant. But the tension developed can be increased. Tension developed changes. And what is the examples? Example is whenever any dynamometer is there or you are holding a heavy object and compressing it and keeping it, those are the examples of isometric exercise. Another example is pushing against the wall. Pushing against the wall, or whenever you are trying to lift something that is not not liftable, that is so heavy to lift, then what happens? The contraction keeps on happening but the weight is not lifted. So what happens here? Here the muscle length stays constant but the tension is increasing in the muscle. So those are the examples of isometric exercise. Now we should know about the BP changes in isometric and isotonic exercise. First we will discuss the isometric, which is easier to discuss because in an isometric I ask you to hold a hand grip dynamometer. What you will do, you will keep on holding it, compressing and holding it. Here your muscle length will keep constant, but as time progresses your tension in the muscle will keep on increasing. So let's see what happens to the systolic BP and diastolic BP. So they change according to the grades of exercise. We have several grades of exercise like mild, moderate, severe and very severe. This mild, moderate depends upon the oxygen consumption. There is something called as VO2 consumption. Oxygen consumption differentiates these exercises. Otherwise, they can differentiate with them heart rate also. Heart rate is like another parameter, easier parameter where you can classify these four exercises. So what happens to the systolic blood pressure? The systolic blood pressure is dependent on what? Directly proportional to the cardiac output. The cardiac output is more, the systolic blood pressure is going to increase a lot. The diastolic blood pressure is directly proportional to TPR. What is this TPR? TPR is total peripheral resistance. So cardiac output is dependent on stroke volume into heart rate. So first let's discuss about the systolic blood pressure. Whenever somebody is exercising, what happens to the sympathetic activity? The sympathetic activity is going to increase. So what will happen to the heart rate? The heart rate is going to increase. And the venous return to the heart is increased. What will happen to the stroke volume? The stroke volume also will increase. So both stroke volume increases there and heart rate increases there. So obviously the isometric exercise or any kind of exercise, the systolic BP is going to increase only. And why we have put many arrows? Depending upon the intensity of the exercise, the intensity of rise of the systolic BP also will be more. Coming to the diastolic BP, in an isometric exercise, what we are we are trying to put some external compression to the muscles. So whenever you put external compression to the vessels, what will happen? The total peripheral resistance will increase. So whenever you're trying to push more harder, so what will happen? More total peripheral resistance will increase. So the TPR keeps on increasing and diastolic BP is dependent on TPR. So if TPR is increasing, then the diastolic BP also will increase. So what will happen in isometric, whatever the grade of the exercise, the diastolic BP is going to increase accordingly. The diastolic BP will be increasing according to the grades of the exercise. So this is one of the reasons why it is not advisable to give an isometric kind of exercise to that of the cardiac patient. Because in a cardiac patient, I don't want the diastolic BP to go high. So we always not prefer this isometric exercise, especially in cardiac patient. This isometric group of exercise is very good for muscle builders and weightlifters. But other than that, the isotonic exercises are better. So coming to the grades of exercise in isotonic, the same grades are there. And the systolic BP, it is pretty simple. It is going to increase only. Because sympathetic activity, whether you do isotonic or isometric, the sympathetic activity and the venous return are going to increase, which is going to increase the systolic blood pressure. When coming to the diastolic blood pressure, what happens here? Whenever that person is doing a mild exercise, there is not much of change. No change happens in diastolic BP. But as and when the grade increases, what happens? In moderate exercise, it can be normal also, or slightly it can be decreased. Why there is a decrease here? Because whenever a person is doing a exercise where there is contraction relaxation is happening, there will be accumulation of metabolites, and this metabolites, what it will do is they will vasodilate. So whenever vasodilation happens, what is going to happen? There is a reduction in total peripheral resistance. So whenever there is a reduction in total peripheral resistance, there can be a decrease in diastolic blood pressure. In severe and very severe exercise, it can be normal or decreased or increased. Any of it can happen. Normal, decreased or increased in severe and very severe. Especially in very severe, there can be an increase also. So decrease is understandable because we are doing metabolites are accumulating, vasodilatation is happening, total TPR is decreasing. How can an increase happen in case of an diastolic BP in isotonic exercise? In isometric, the answer is pretty simple. There is external compression which is compressing the vessels. Whereas in case of isotonic, what happens? Whenever a person is exercising, there happens something called as group of muscles are present. So one is the exercising group. Exercising group. So the exercising group, what is happening? There is accumulation of metabolites. There is accumulation of metabolites. So it will cause vasodilation. So it is causing vasodilation. So there can be decrease in BP. And rest of the group, for example, whenever you are exercising, your GIT will not be functional, your renal system will not be working. So the blood supply there, the splanchnic circulation there, that will be diverted to the area where it is required. So that group is called as non-exercising group of muscles. So what happens in the non-exercising group? There go for vasoconstriction. Whenever this vasoconstriction is happening, what will happen? There is an increase in TPR and the diastolic BP can increase. This vasoconstriction, usually it does not happen to extreme levels in mild to moderate and even in severe exercise. In very severe exercise only, the body's demand goes so high, and finally what will happen? There will be an increase in total peripheral resistance, and which can increase the diastolic. So whenever the vasodilatation happens more than the vasoconstriction, what is going to happen? There is going to be a decrease in diastolic BP. Whenever vasoconstriction is happening more than that of a vasodilatation, there can be an increase in diastolic blood pressure. So this is the balance that is constantly happening in the body. And coming to the last thing, that is the energy sources in the muscle. What are the different type of energy sources which is provided for the muscle during exercise? So first, coming to the first source, that is phosphocreatinine. Phosphocreatinine system. This phosphocreatinine is nothing but the stored forms of ATP. They can constantly get converted to ATP, and phosphocreatinine will be stored, and ATP, it can be converted to ATP rapidly. So this will be the first one to give you energy. So whenever you are starting your exercise, this will be the first thing that to kick in to give you energy. But the disadvantage is it lasts very, very little time. So in which kind of sportsmen or players it will be helpful? It will be helpful for the heavy lifters because they need sudden bursts of energy, high energy sudden bursts they needed. That's why they try to build their muscles and increase the phosphocreatinine system. Usually for a long runner, we don't need this phosphocreatinine system that much. For them, the endurance is more required. So coming to the next system, which is called as the anaerobic system. Anaerobic system. This anaerobic system is due to we are getting the ATP molecules from lactic acid. From the lactic acid, it is broken, and finally it is giving the ATP. But that also will be sufficient for 3 to 5 minutes only. For sprinters, this must be sufficient. But for a long run person, this will not be sufficient. Don't think only those systems kicks in that level. It is like all the system will start to act, but predominantly in the beginning phosphocreatinine will give, then anaerobic system will give, then finally the aerobic system will try to give in the energy. Aerobic system is dependent upon the oxygen consumption. So as and when more and more oxygen is being consumed, what will happen? More and more intake of the oxygen will happen, and more energy can be produced, and this produces an unlimited supply of an ATP. So it is for the long run or marathon runners, long runners. It is very, very essential for the long runners. So these are the different types of energy system in the muscle group.